Welcome to the Arizona School of Dentistry and Oral Health, and we look forward to informing you of your options in restoring your missing tooth or teeth. We will be discussing the pros and cons of the various treatment options that you have to restore your teeth. I am Dr. Tomeh, one of the Comprehensive Care Unit Directors at ASDOH, and I appreciate your willingness to be involved in this trial program using different methods for informing patients about their treatment options. Every patient has different needs and preferences. Decisions should be made on an individual basis with discussion with your providers and your full understanding and comfort with the option. We will be discussing the three main options for treating some missing teeth, and they are a fixed partial denture or FPD, an implant restoration, or a removable partial denture or RPD. When patients lose one tooth, replacement of this tooth is ideal through an implant restoration or a fixed partial denture, which is also known as a bridge. Replacing the teeth is ideal for intra-arch and inter-arch stability.
When a tooth is lost, adjacent teeth may drift into its former position. The opposing teeth begin to extrude, and forces on the remaining teeth are increased. Those that have been weakened with decay and fillings can break. One option for replacing missing teeth is a fixed partial denture or bridge.
A bridge is a connected prosthesis that rests on the two adjacent teeth next to the missing tooth space. This means that it requires putting crowns on the adjacent teeth. If the adjacent teeth already have crowns on them and the remaining tooth structure on the teeth is sufficient, then this is a reasonable option. But if the adjacent teeth do not have crowns on them, then this option would require drilling on the teeth to make them the right shape for crowns attached to the fake tooth over the space. Once a fixed partial denture is placed, patients must make extra efforts to clean the teeth and under the fake tooth as well. This video will demonstrate that process.
When you're flossing a bridge, ideally you want to use some super floss, that way you can thread it underneath. So we're going to start it on the cheek side, thread through in between the teeth until we get to the fluffy side. Then we'll pull it on through on the tongue side. Using that fluffy little bit, we're going to go up underneath the gum against one tooth, across the bridge, and then up against the neighbouring tooth, making sure everything's nice and clean, no little chunks of food or anything coming out. If it does feel tender or you get any bleeding, just see it as your body letting you know it needs a little extra attention in those spots.
As you can see, this involves using a floss threader or super floss to pull the floss through to the underside, just like threading a needle. Sliding the floss under the underside of the fake tooth and flossing the front tooth and the back tooth up and down like usual. Use of interdental brushes can also be helpful if there are gaps between the teeth or difficulty with dexterity. A water pick may also be used to remove debris, but flossing is the best way if possible. If the teeth adjacent to the space are not crowned or do not have large restorations on them, it is ideal to place an implant. Placing an implant requires sufficient distance from important structures such as the maxillary sinus or nerves, sufficient bone in the area to stabilize the implant, and that there be no medical contraindications. Major benefits of implants are the improved cleansability as it functions like a single tooth and the stimulation of bone. An implant restoration takes time as the first step is to extract the non-restorable tooth, and healing must occur with or without a graft. The healing of a graft can take a few months. Then the implant is placed without a restoration, which requires another few months to integrate into the bone and attach to the gum tissue.
So what exactly are dental implants? Dental implants are a different way of replacing lost teeth, as they are fixed in your jawbone so they function more like a natural tooth. Implants can be used to replace a single tooth. They can replace several teeth to hold a fixed bridge. The process for having dental implants involves two separate surgical procedures. The initial surgery is to place the implant post in the jawbone and is usually carried under a local anesthetic. An incision is made in the gum tissue before a hole is precisely created. The implant is placed into the hole and the gum is stitched shut. The site is left to heal so the implant post can integrate firmly with the jawbone. During this process, new bone cells will grow on and around the implant post, ensuring it cannot move and that it is strong enough to support a restoration. To assist healing, dental appliances should not be worn for the first few days after surgery, as it is important not to put pressure on the site. If you must use the appliance right away, it might be possible to adjust it so it does not touch the implant site, thus avoiding placing pressure on the implant. If the implant post has been successful, then the second surgical procedure is to create an opening in the gum to expose the implant. and placing a post known as a healing cap. This is so a tooth can be attached that will extend above the gum line into the mouth. The cap is used to shape the gum tissue to give support to the crown or bridge. The final phase is to thread a metal sleeve known as an abutment into the implant, and this will be used to hold the crown, bridge, or denture firmly in position. At this stage, your final prosthesis can be constructed.
Implant restorations can also replace multiple missing teeth, but this requires the placement of additional implants. Implant placement requires surgery, which carries the risks of surgery, but offers the best cleansable option, which stimulates bone. Our last option is the removable partial denture. The benefits of a removable partial denture are that it can replace multiple missing teeth, such as when they are missing from multiple areas in the arch, with one prosthesis. It often requires crowns on the teeth adjacent to the missing teeth spaces or modification to some support teeth for stability. It can replace missing soft tissue as well as teeth, which can make it an aesthetic option for those with insufficient bone for an implant who cannot undergo bone augmentation. A well-designed partial should not rock excessively and should not put undue stresses on any tooth. But the less teeth remaining in the arch, the more forces there certainly will be on the remaining teeth. Removable partial dentures are often the less expensive option for replacing multiple missing teeth. Oftentimes we need to change the contours of the teeth for removable partials or even place new crowns on the teeth in order to afford the best mechanics and stability of the partial. This modified tooth shape or new crowns help guide the partial into place and help keep it stable. Removable partial dentures require removal of the partial every day for proper hygiene of the teeth, including brushing and flossing, as well as cleaning of the partial. Here's a demonstration of how to appropriately clean partials. Partials accumulate food debris, plaque, and stain with use. Removing this buildup requires gentle scrubbing with a brush every day to help mechanically remove it and maintain a hygienic partial. Plaque accumulation on the partial can cause cavities in the teeth as well as periodontal problems and bone loss. Clean the partial with a damp denture brush and cleaning paste in order to remove the buildup, as the plaque does not simply rinse off. Then, placing the partial in a disinfecting solution made for partials is also good hygienic practice, but does not replace mechanical cleaning with a brush. The remaining teeth also require brushing and flossing so that they do not get cavities or bone loss. In summary, one option for restoring missing teeth is a bridge or fixed partial denture, which is good in situations when the adjacent teeth have existing restorations or if there is not enough bone for an implant. This requires strong adjacent teeth that are supported by good bone levels. FPDs also require extra steps for cleaning. Implants are the restoration that most resembles a natural tooth, as it stimulates bone and is easy to clean. It takes more time to plan and restore an implant due to multiple steps, including healing and two-stage surgery. Implants can replace one or more teeth, but more teeth requires more implants. Implants require surgery, an evaluation of sufficient bone, and no medical contraindications. Removable partial dentures can easily restore multiple teeth in one prosthesis, but these prostheses do not stimulate bone and may require reline or remake due to changes in tooth or bone support. RPDs may require that crowns be placed on support teeth for stability. RPDs also require extra steps to be taken daily to clean them, as well as the remaining teeth. Thank you for watching our educational video. We hope that you found it informative. We look forward to treating you at ASDOH. A special thanks to student Dr. William Yuan for his assistance in the editing of this video. We are also thankful for the available online YouTube videos that were useful as well.